shifting gears, take a 2-second break, because I still will let you out of here in about 15 minutes. And then we'll come back in the morning. You did spend some time, I believe, with Linda Wednesday night talking about Senator Casey's Better Care, Better Jobs Act. Yes? No? I don't think she'd fib to me. Okay. Yeah. And again, this is not new legislation. It was in the Congress the last time around as well. Did you give this to them the other night? The summary?
This one?
Yeah, we have.
It was on the.
It was on the link. Okay, good. Great. Well, if you don't have it, we've got copies. All right. Okay. This is the bill that we are going to use for the meetings tomorrow when you meet with a couple of congressional office staff, and we will probably have a couple of people who will be doing role playing because some of the offices didn't respond. We can't control that. All right, basically, whoa, come on. And it's in this state and every other state. I'm going to give you just a couple of other things to look at tonight and then in the morning to practice. What we're doing tomorrow, just to give you a heads up, since we only have one bill, that's really a good thing. You don't have to vote, I want to work on this one or that one. But you're going to be working in groups of no more than 4. We'll regroup as a whole group in the morning, and then we'll go through things. You're going to break up in a group of 4, and I'm going to give you an outline practicing for a 10-minute meeting, 10 minutes, with a member of Congress or his or her staff. And the same would also work state legislator, because I do this for state, but this is for federal. And so you're all going to have time to talk about this in your group. Each group will talk about it differently. And then you're going to figure out there are 4 or 5 different roles. Who's going to open? Who's going to talk about the bill? Who's going to tell a personal story or a couple of personal stories? Who's going to do the wrap up, what we call the ask? It's really a sales presentation. You're asking them to vote for or support this piece of legislation. What it has to do with is 3 things that you should know about. 1, the massive waiting list for home and community-based services. Okay. Number 2, the critical workforce crisis in this country, not just in Alabama, for what are called, ideally, direct support professionals. It has always been a problem, low wages, high turnover. It is now at crisis since the pandemic, and people are burned out. People aren't applying even where wages are up, and I'm going to give you some information on that so you can talk about it as a national problem, not just a problem here. And then it comes back to the settings rule and inclusion. So it's really about, we've got to put more federal money in. We've got to push the states to do more to make sure that home and community-based services with Medicaid money are done correctly, that staff are paid well, that staff have to be trained. What a novel idea. And again, I'm going to show you stuff. In most states, the training is, can you give first aid and CPR and know how to give medicine? Okay, nothing about helping a person have a good life, nothing about taking them out in the community as an individual, rather than, okay, we'll put 6 of you on the van and we're going down to the restaurant, whoopee-doo. Okay, what if I don't want that restaurant? Too bad, we're going to Pizza Hut tonight. If you don't like pizza, you can stay here at the group home and just have whatever's in the refrigerator. No vote, no democracy, no choice. Baloney. Oh, that's what I want baloney. Okay, but I'm serious. That is what this legislation is about, and getting the federal government to put more money in, okay, which is not very different from what I read you earlier, if you remember it, from the Republicans in the House committee, Kathy McMorris Rogers, who is the mom of somebody with Down syndrome, talking about our policies are all wrong and we're creating dependency and poverty. This is the same thing. We don't want that. Maybe they'll get together. That would be really beautiful, okay? But this bill is about pushing more funds, enhancing the match. By the way, you get one of the highest match rates if you don't know that. Medicaid goes by per capita income. The wealthy states get 50 cents on the dollar from the feds. You get 77. So for every $100 of Medicaid in Alabama, the federal government is paying 77. The Alabama General Fund only pays 23. Not bad. Where could I put down 23 and get 77? Every hour of every day. So putting up a lot more money is going to get a ton of money into this state. They may know that, they may not. We'll get into some of the Medicaid problems. So that's what this is about. And your thinking about that tonight will probably help. And I'll give you just a couple because I've got other things, but I don't want to do it all. I'm going to give you, because some of you may decide to really focus on the workforce crisis, and some other group may decide to focus on the waiting list. This is a report from ANCOR. This is the largest trade association of providers in the United States. If you've not heard of them, they did a survey in 2022. You have the results here. It is painful. Nationally and by states, and Alabama did participate, what the turnover rate is, what the length of time is, what the burnout rate is, what the average wages are. We expect people, in my opinion, to do really important work now, and the average in the United States is like $14.50 an hour. I can go work at McDonald's these days probably for 15 or 16. Where I live at Costco, they're starting people at $18 an hour. Okay, why would I want to do this for 14? But again, if we raise the credential, maybe then we could get the legislature to say it's worth paying $20 an hour, but they're going to be expected to have skills and not just show up and be a warm body in the room, right? So I've given you that. We've talked about inclusion. And again, for people who might want to work on it, and then I'm going to stop. This is from the state of Utah, from their website, how they define community inclusion. This is the Utah state government, not the advocates in Utah, just to see what they believe, and I agree is correct, is what this is supposed to look like in your state for you or other people. So that'll be the one last handout for tonight. This other stuff we can wait for till tomorrow. But again, before we break, we got about 5 minutes now. Okay. For tonight, go have some fun, socialize, relax. If over breakfast you want to start talking about some of this stuff tomorrow, that would not be a bad thing. We'll regroup as a total group. I'll probably spend 15 more minutes. What I would like everybody to do, maybe for homework, is read the Casey two-pager, the front and back, mark it up with any questions or comments. Some of you have seen it before. The other stuff, if you can look at, fine, we'll go through that. But I think if everybody will have read this two-sided paper, that will be useful. That's it for now. This is for tomorrow. Yeah. Yeah. Pardon?
What is the status? Has it been?
It's been introduced.
And
It's been